All right, so we have a little bit of time for discussion. And before I assert the moderator's privilege, I see the chair of the planning committee, so I'll defer.
This is for Deborah. The list you put up of kind of the things that family needs is very similar to what the goals of the Nurse-Family Partnership, David Oll's program, is. Do you know if he's looked at the effect of the Nurse-Family Partnership, nurse home visiting on bullying kids?
Someone else in the room might actually know the question. I actually searched to see if he looked at bullying as a particular outcome. It has effects on other forms of aggression and delinquency, but I don't know that he's looked specifically at bullying. I don't know if anyone else in the room might.
I don't think so. I followed that work too because I came out of Cornell where it all started. And I haven't seen it specifically on bullying, but there's definitely, it's mostly CBCO kind of
Right.
outcomes. So you could probably pull out an item or two that might get into it, but I've never seen them publish that level of disaggregation data.
Right, and so part of what I tried to do is look at some of studies like the old study and other family-focused interventions or parenting interventions, and I think part of the problem is that the most well-known studies are now 20 or 30 years old, and we didn't have those measures, and we don't have those measures, so I think it's hard to go back and see if we could have that. But I think that there are studies where I think that researchers could go back and pull out some items and look more specifically at bullying as an outcome.
So just a reminder, before you ask your question, if you could state your name and affiliation. And then for those of you on the webcast, if you have questions, please submit them and we'll work those into the discussion. Yes.
Hi, I'm Abby Fagan. I'm at the University of Florida, and I'll be participating tomorrow as a speaker on the translational panel. And my question kind of relates to that, because I think one of the biggest challenges in assuming we had parenting interventions that would reduce bullying and we wanted to implement them more widely, or if we take some of the other models and try to replicate them. You kind of mentioned, Deb, briefly that it's hard to generate an uptake of these programs in the community, and I think that's particularly true of these family-based interventions. And I wondered if you had any good ideas for how to engage parents, how it worked in some of your other trials, and if it would be easier or more difficult around this issue of bullying prevention?
I have a lot of ideas because it has been so hard. So in Safe Children, with a lot of these, so these are high-risk schools and neighborhoods with a lot of work, going to people's homes, knocking on people's doors regularly. We had 75% of those who were randomly assigned to the intervention complete at least half the session. We moved to do a trial where we partnered with a local community mental health agency to do an effectiveness trial to see if we could have the same effects. And our biggest challenge was participation. And there were two things. One, and I could talk about this for a long time and I won't, was that there was a real, most of the practitioners that I work, social workers, school social workers and people working in local community mental health agencies have been trained in a model of people come to you when they're seeking services, when they need help. And in fact, many of the people that I talked to in the communities initially talked about prevention as being unethical. That they felt that we were intruding on the lives of families who were not necessarily asking for any kind of help. So I think it speaks to an issue around workforce and training and how we think about training early on in high school and college. Around prevention more generally, because I think part of it is about working with families, but part of it is this idea of prevention. And then the other piece is it really does take a personal connection with people. You can't send a flyer home and expect people to come. It really takes having some sort of connection. So we've been working around a few different kinds of strategies. We have families that want to go out and do the recruitment for us because they feel like they've learned so much. So we've are actually putting together a little randomized controlled trial where we put together testimonials from families that now interventionists can have on their smartphones, and they're people that look like them and they might even know, and to see if that increases participation. But the scalability of working with families has been a real challenge. On the other hand, I don't know how we really move the field forward if we don't figure out a way to engage parents and families more than we have. Sorry if that was long.
Yes.
Thanks. My name is Thayer Hardwick, and I'm at the Children's Law Center here in DC. I have a question. Once parents are already engaged and concerned about a bullying incident, I was wondering if you could flesh out your experience with best practices for how to involve the school, both in cases where, maybe the child is young and it's just a matter of reaching out and requesting assistance, but also in cases where retaliation is an issue and the family is concerned about that.
Yeah, good question. Thank you for the question. I think the key point really, and you can certainly add to this, is just that parents do reach out to the school and collaborate with the school in terms of the intervention. So ideally, in either case that you mentioned, whether it's on a lower level or a broader level, the school has policies and supports in place that the parent and school can work together with to help the child. But that's not, I suppose, the ideal circumstance in which the school is invested in trying to help as well. But I guess that would be the bottom line, sort of working with the school closely on dealing with the problem.
Yeah, I guess I would just add, I think, and I think there'll be some conversation about this tomorrow, that there's not a single and simple answer to this, and so I think what we're starting to understand is that we need to build a more comprehensive strategy that needs to change norms and attitudes about bullying. I know, and there are probably other people in the room that can talk about it, there are lots of examples of incidents where, as you suggested, it actually does seem to increase risks sometimes, because not all parents believe that bullying is something that should be taken seriously, and so they. It's one of those, it's a rite of passage, boys will be boys, and that just speaks to, I think, the bigger issue around changing norms and attitudes around aggression and violence and bullying more generally. So I think it's complicated, but it is complicated, and I think parents can't go in being very naive about what all the potential consequences might be. And hopefully there's an enlightened administrator that can help with that.
Yes, please.
Hi, Deborah Temkin, RFK Center. My question is about how we influence how this particular research is used. I think the big difference between research that demonstrates that parents play a role in a child's risk for bullying or being bullied versus a school is that parents are only two individuals usually, and a school is a much broader organization, and so this blame element comes in. And you see this even more when you have states and localities passing laws that now ticket or fine or criminalize parents for their child's bullying behavior. I also experienced in trying to frame some of this research to present to parents the resistance that, oh no, now you're going to make parents feel that you're blaming them for being bullied. So how would you recommend how we make sure that this research is used in the right way and people can understand it without that blame aspect?
That's a great question. So, and I think that as someone who, I often do study that link between sort of the family context and what's going on in bullying, I think it's really important to highlight that while it increases risk, that's not, of course, always the case in the majority of the cases of kids involved in bullying. So just being able to educate parents around, for some kids that's a risk factor, but there's many other things that come into play, and, it certainly can't be all placed on the parent. So I think broadening that conversation and making sure that, we're presenting research that says there's this increased risk linked to family environment, that we're not saying this is true across the board or that parents are the sole contributors to what's going on.
And I absolutely agree. I also would talk about it not as preventing bullying or preventing violence, but supporting healthy and positive development, and that. And I say this to families. I've worked with thousands of families. I've never met a parent who didn't want something better for their kid than they wanted for themselves. And parenting is hard. There's nothing, even in the best of circumstances, it's hard. So it's much more talking about that it, this idea of, it does take a village. It takes more people. You need other support to try to, we don't have all the answers, and it's okay to try to seek help in trying to manage some of these situations and get ideas from one another and find out what's going on in the school and the neighborhood and talk about it that way. So I always try to, even though that's not necessarily how I presented that today, but really try to focus it on what do we need to do within families and schools to try to help support what we know we all want for kids? I don't know.
So I'll jump in and ask a question or two, seeing no one waiting at the moment. I'm interested in hearing from both of you about other actors. We've focused a lot on parents, and I think about this in two ways. That other actors who are playing parental roles, that may be grandparents or other non-traditional families. And then also, there was very brief mention this morning about siblings. And I recognize fully, I'm springing that on you a bit because that wasn't part of the discussion in advance. We were focused on parental roles. But if you've, what the research might say about siblings, or what you'd like the research, where we go on that piece as well.
I guess I'll start. So let's see, good questions. I think in terms of the first question, in terms of the role of other parents in their lives, I think that obviously it's quite plausible that whoever the child is living with is going to have that same influence as parents. In terms of what's known out there, I think there's just a limited body of research, and most of the research in terms of the samples predominantly have either one or two biological or sometimes adoptive families in the home, but typically non-traditional family structures haven't been assessed, so I think that's an area that research could grow and develop in. In terms of sibling aggression, as you noted, it's certainly becoming more common to talk about that, and others might be able to speak better to it, but we do know there's this association between what's going on between siblings and then what plays out in the school context as well.
The only thing that I would add, I agree. So when I should probably be more careful about defining this, when I say family, I mean that very broadly. And in our interventions, it could be grandmother, aunt, it's not necessarily, and certainly very rarely is it mother and father. And these are also whole families that are included. So it includes siblings. And so part of what at least these interventions and then the other interventions that I briefly mentioned are really trying to work on not just the parent-child relationship, though that is part of it, but really the relationships that are occurring within the family, including between the siblings, because certainly I think I'm not a sibling researcher, but there's enough research to suggest that certainly what the aggression that's happening within siblings is also something that's a risk for bullying and also victimization.
Question.
So my question is related but unrelated. Particularly as you were talking, Melissa, one of the questions that I had is sort of then who do you believe? Right? So you've got the concurrence of reporting, and then sometimes you've got the child, but the parent says no, and then interestingly, the parent says yes, and the child says no. So who's right?
I don't know. I think it's a great question. I'm not sure. I was surprised, frankly. The part I was most surprised about was the 30% of parents who said they thought their kid was involved and the kid wasn't. I'm not sure. I think it also has to do with perception. So I know a lot of your work around definitions and how you're defining it gets at that. So, does it matter who's technically right, or if the child perceives that that's their experience, that's what's going to influence sort of mental health and that sort of thing. So that's what we need to address. But I don't know. It's a great question. I think more work needs to be done in this area.
Can I answer that, Melissa? When you think about Yuri Brofenbrenner's work about what matters most for behavior and outcome is the environment as it's perceived by the individual, rather than how it exists in so-called reality. So I would argue that ultimately, when you look at mental health, children's mental health, outcome is attached to perception. So I would say that if we're thinking about what the implications are, what their trajectory is for health, I would look at the perception of the individual.
Right, I absolutely agree. And I think that was reflected in one of the slides I showed, in that the kids who perceived that they'd been teased were experiencing more problematic mental health than the parents who thought so. So absolutely, I think that perception, whether it's real or not, is linking to sort of worse outcomes, or in that case, correlates.
Are there other questions at this time? Then please join me in thanking our panelists. I believe we'll have a short break now, but we'll hear about that now.
So let's all take a break. Why don't we convene back here at 3:20?